Thank you very much. Minister, the Parkinson's Association are looking for proper care for people nationally with Parkinson's disease in Ireland. And with only a small number of specialised Parkinson's nurses in Ireland, we are nationally falling way behind. Minister, there is a need for at least 20 specialised Parkinson's nurses in Ireland, and the very least that should happen in this budget is set aside funding for 6 this year. So, Minister, you might be able to tell us what are your plans in relation to Parkinson's sufferers in this budget.
Minister.
Please.
Thank you very much for raising the issue, Deputy. It's a very important issue, and actually I met some of the representative people outside the Kildare Street gates just last week, and we discussed exactly these issues. So the HSE's National Clinical Programme for Neurology has engaged with the patient organisations to identify service requirements for neurology nurse specialists. The clinical programme does recognise the value of highly trained nursing staff, and it endorses the expansion of the neurology nursing workforce, including for Parkinson's disease. I have to say I support it as well. I met many years ago patients with Parkinson's. We went through the ratio of specialist nurses in the Republic versus Northern Ireland, and the reality is that the ratios are much higher in Northern Ireland, and I think we need to increase it, which is exactly the point of your question, I think, Deputy. So there's currently 5 Parkinson's disease nurse specialists in acute neurology centres. The HSE plans to increase specialist nursing capacity in areas including Parkinson's. Now, building a specialist capacity of this nature does take several years. There's training involved in recruitment and deployment. The HSE will be guided by the work of the National Clinical Programme to ensure that priority is given to the areas of greatest geographical inequity to begin with, and that the neurology subspecialties most in need. But Parkinson's, I believe, must be one of the priorities. I don't believe we're providing the level of service that's required, and I certainly will be looking to the next budget to begin to address that. Now, as well as this, the HSE implementation framework for the neuro-rehabilitation strategy also provides guidance for the development of specialist neuro-rehabilitation services across the continuum of care for people with conditions including Parkinson's, including in the community.
Thank you, Deputy Collins.
Thank you very much, and thank you, Minister, for your reply. And I'd like to acknowledge also Deputy Carol Nolan, who put this question together for me. Minister, you know, we hosted the Parkinson's Association, and you met them outside the gates before they came into the AV room, and you know, from Cork and Dublin, throughout the country. We were told that there is no Parkinson's consultant in CUH since 2016. There's been a promise of replacement time after time for years, but still nothing. We're also told they have no specialist Parkinson's nurses in Cork since 2021. Now, Minister, that's an astonishing situation Parkinson's sufferers find themselves in. Imagine no consultant there since 2016. This is an unfair situation that the people of Cork and people of Munster find themselves in. Now, I know it's a national issue that there's a lack of specialised nurses, and when you say there's only 5 in total, it's a national issue, yes, but it certainly is a crisis issue in Cork, and I'd appreciate you might address that in your answer.
Thanks, Deputy. And yes, I do recognise that there is a shortage in the Cork area, there is a shortage in the Munster area, and in fact it's one of the things that was raised in the conversation I had with the representative with the patient group just last week. So the short answer to the Deputy's question is, can we look at Cork, can we look at the Munster area as one of the areas that clearly does not have the level of resource that it needs, and therefore is one of the areas that can be prioritised? Yes, we can of course look at that. There is annual funding of nearly 3 million provided to the first managed clinical rehab network. Now, the pilot project accepts patients on referral from hospitals. It uses multidisciplinary teams to serve patients with complex needs who don't need the inpatient facilities. And the learnings from the demonstrator pilot will help inform this national rollout, which the Deputy and I are discussing at the moment. And it will look at experiences and outcomes for all neurological conditions.
Thank you very much, Minister, for your reply. Minister, I visited a house in my constituency 3 weeks ago, and I was asked to meet a person that was suffering from Parkinson's. When I went to the house, I found out there was 3 people in the one family that had Parkinson's. And the sad thing is, Minister, I couldn't advise them where to go. The only help I could offer them was Tony Wilkinson. And Tony is, I hope, is tuning in tonight, because Tony has been a Trojan worker for Parkinson's sufferers right throughout the country. And I think you met Tony outside the gates here last week. But imagine that. Imagine that the only person that I can send them to is a person suffering from Parkinson's themselves. And Tony's an expert and a genuine person. He gives hours and hours every day trying to help people. But he's not the specialised nurse, and he shouldn't be treated like that. And people that are suffering from Parkinson's are falling on the ground, are costing the state millions of euros when they could get a little help if those specialised nurses put in place, whether it is in Cork or throughout the country. And I'd appreciate, Minister, that be addressed straight away.
Please, Minister.
Sorry.
Thanks, Deputy. And yes, I did meet Tony outside. So look, at the moment, we've got 5 Parkinson's nurse specialists in the acute section, in acute neurology. They're in Limerick, St Vincent's, Tala, the Mater and Galway. And to your very point, we don't have one of the nurse specialists in Cork at the moment, and it's something that we need to address. And indeed for other parts of the country, as well. And the National Clinical Programme for Neurology's aim is equitable access to a high-quality service, and I think that really has to guide where we invest, where we deploy the specialist nurses, both to the area, which is Parkinson's, and indeed, as the Deputy has said, geographically as well, recognising that there isn't one of these 5 in the area at the moment.
Deputy.